Assalamualaikum viewers and welcome back to my channel Biodenverse Hub. Today we will be discussing out some important topics and stations that might come in your OSCE examination. Keep that in mind that it is a general OSCE guide and topics and stations that are discussed in this video are the high yield and important ones. It could be modified according to your own board of examinations. This video is just a general guide to give you people an idea that what type of question can come in your OSCE exam and what is basically the pattern of an OSCE examination, how you need to approach the topics for your OSCE exams. So let us proceed on with that. First of all, there are some must-do topics you need to do for your OSCE examination. You need to have a special preparation for those topics in that include your endodontic files. You need to identify the H in the K file, the pro tapers. You need to know that how to differentiate the H and the K files from each other and from the pro tapers, from the prezo-reamers and the GG drills, the sequence of GG drills, their uses, and then the rotary files. The identification of rotary files that they have a latch type and that is being inserted into the engine-driven handpiece, and how you need that is basically differentiating feature from the manual files which don't have a latch type. So these were some important points regarding the identification of these endodontic files. Then the matrices. Matrices are basically important, and you can be asked about the ivory matrices, the TOEFL placement technique. It has just a whole station about the TOEFL placement. Along with that, you need to do the parts and uses as well. Then the wedges. Wedges, you need to know about the types of the wedges, the placement technique for the wedge, and then different types of placement techniques as well. That is the single, the double, and the piggyback techniques. Then the radiographs and clinical pictures. It could be given in your OSCE stations. The radiograph can be given different types of conditions, and you could be asked about the diagnosis or the signs that are shown in the radiographs. For example, the signs of the vertical root fracture, that is the J-shaped radiolucency. Then on the radiograph you can be given about the pulpal and periapical diagnosis. And then the clinical pictures, which may be of that of a pink tooth or the abrasion, erosion, and affraction. After that, we need to know about different kinds of instruments being used in the endodontics and the operative and conservative dentistry. That includes the pluggers, spreaders, filling instruments, handpieces, air-driven, motor-driven, and then contrangle handpieces, different types of handpieces. You need to know about that. The burrs, which kinds of burrs are used and which type of burrs is specific for specific features in the cavity preparation. Carbon initial amalgam gun. Most importantly, you need to know about the apex locator. Apex locator, you need to know about the principles of apex locator, the different generations of apex locator, and then the examples in those generations, the paths of apex locator, the uses, the indications, most importantly, the contraindications and disadvantages. And at last, there are different color-coded lines that will give you the readings of apex locator. And then you are asked that how you will take your reading out of those lines, which lines are important and which lines you need to go for while taking your final readings out of it. Then the electric bulb tester. It can come in your OSCE station. You can be asked about the electric bulb tester, the principle underlying it, the procedure of performing that test, which is very much important, and then interpretation of it, different responses. That could be a lingering response, the exaggerated response, and in which kind of diseases these responses are produced. Then the uses and disadvantages of EPD. So traumatic injuries of the tooth, which is very much important, and you need to do all kind of traumatic injuries. You will be given a clinical pictures or either a radiograph or just a direct scenario can be given. Then you are asked about the diagnosis and the management protocol. In some cases, you can be asked about the classification of traumatic injuries as well. So you need to prepare that very well. After that, the endodontic emergencies and flare-ups. You will be giving those topics is special consideration because it very frequently come in the exams. Is that just the patient had initiated his root canal treatment, and after the first visit of pulpectomy, the patient reported within 24 hours with the pain. How you are going to proceed on with that? What are the management protocols, and what is, first of all, you are being asked about the diagnosis. That is the endodontic emergency, that is patient reports with severe kind of pain within the 24 hours, that is the endodontic flare-up. So this was a whole station of the endodontic emergencies. Then most importantly, procedural accident. And the procedural accidents, there are different kinds of procedural accidents. You can be asked about the perforation, file breakage, ledge formation, hypochlorite accident, the root fractures. In that procedural accidents, what kind of questions that are asked are basically that they first of all will give you a scenario, and then you will ask about the diagnosis. Then they will ask you about how you are going to manage that disease, manage that accident, and most importantly, how you will inform the patient. Your way of informing the patient and taking the patient in confidence, that is important, and that may become in your interactive station as well, in which examiner will check your way of informing the patient and how you are dealing the patient, how you are considering all the pros and the cons of and prognosis as well of that tooth. So most importantly, you need to work on the counseling part as well. Then preoperative consent form, basically in that you just inform the patient about that there are different kind of complications that may occur. So most importantly, before the starting of the procedure, you need to sign the consent form from the patient. Then we have some materials as well that can come in your OSCE examinations at different stations. First of all, the irrigants. In irrigants, you can be asked about the types of irrigants, the uses and identification. Different irrigants will be present out there on the station, and you can ask what type of irrigant is this, what is the name of the irrigant, what is the use of irrigant. Most importantly, you are asked about the irrigation protocol, that how you are going to irrigate your canals. So you need to know about that as well. Then irrigation needles, their types, side vented hair, what is the gauge, and how much they have the volume of the cc's of the needle. So you need to know about all those things. Then in kind of with regard to the obturation, the questions that might come, you could be asked about the techniques, especially in the open apices and the blended pus canal, how you're going to proceed on with the obturation in that cases. Then the type of the GP that is used in the blended pus canals. Then the composition of geta percha, it can come. You can be asked about to write about the composition of the craftsman sealers. Another important material is the glass ionomer cement. The glass ionomer cement, there may be mixing technique that might come, the types of the GIC, the composition, the setting reaction, anything can come in regard to the glass ionomer cement. So glass ionomer cement, you need to do that topic very well. After that, composite is another important material. You need to know about the generations of composite, the placement techniques of composite, everything with regard to that. And then the polymerization shrinkage as well. Then after that, the blue light wavelengths, usually you are using the curing lights for composite. You can be asked about the wavelengths and other types of curing light that you can use for curing procedures. So keep that in mind, and you need to know about different types of curing light. After that, there is a station about the isolation techniques. You can be asked about different isolation techniques, and in that case, rubber dam placement technique, it has a whole station. You need to know about the rubber dam placement techniques, the rubber dam parts, the clamps, how you are going to proceed on with that. So a whole station can be there, and that could be either static one or interactive one. You need to do everything about the rubber dam. And then the discolored tooth, basically a picture of discolored tooth is given, and then they ask you about the differential diagnosis, and I could be asked about the definitive diagnosis as well, and then how you are going to manage the discolored tooth. Root canal preparation techniques can also be asked. You have the different techniques, that is the coronal to apical and apical to coronal, including the different kinds of step back, step down techniques as well. So you need to do that techniques. In the modified double flare technique, you have the balance force technique, different kinds of techniques. Any of them can come in your OSCE station. Then the GV Black's classification of cavities, you are given different pictures of the cavities, and then you are asked about what type of cavity is that, either class 1, 2, 3 or 4 or 5. Then most importantly, autoclave, they can come in your OSCE station. They ask you about the different types of sterilization procedures and techniques, and then about the temperatures and principles of autoclave, which you need to know about. So these were some important must-do topics. Now we will be proceeding on with some important clinical pictures, the scenarios, the radiographs, most importantly how they are being asked in the OSCE examinations. There is a sample questions for you people. So let us proceed on with that. First of all, the first scenario is that 16 years old patient presented with a traumatic injury 10 hours back. Vitality tests are inconclusive. So what is your most likely diagnosis and how you are going to manage that condition? So as in the clinical pictures, you have also seen that the tooth is basically below the level of in case of the maxillary teeth, you will say the occlusal plane, and in this it's above the occlusal plane and it's kind of intruded appearance. And as in the question you have been given the history of trauma, so it is basically the intrusive trauma. Intrusion has been occurred, and after that the whole management of how to manage the intrusion injury, so you have to write out that. Okay, then we have a radiograph given. In the radiographs you are asked that diagnose it, or what is basically this clinical condition called. So it is a condition of dense intent. You can see that imagination in the tooth, that is the radio opaque kind of appearance in the middle, that signifies you about the dense intent. Then we have different kind of pictures that are given of the teeth, where it could be either in the form of attrition, erosion, abrasion, abfraction. So you need to know about how to differentiate these types from one another. For example, we'll consider the erosion of the teeth. This is the first picture is about the erosion of the tooth. Then the point of identifications are asked. So in that you can write that it has a cup-shaped cavity with the round walls that signifies the erosion of the teeth. After that we have different kind of radiographs can be given. Either you can be asked that what type of radiograph is this, or you can be asked about the interpretation of the radiograph. So in this sample question we have a bite wing radiograph. So first of all, you have been asked about the identification of radiograph, and then for what purposes bite wing radiographs are used. So most importantly, for checking out the proximal caries that are not visible on the PA view, and even clinically you can get the idea about the, or just a clear view of the proximal side on the bite wing radiograph. Then we have a counseling station. In that you will be, it could be either most importantly it would be an interactive one, in which you will be asked that 50 years old patient presented with a pain in the lower first molar for past 1 month. Now you have diagnosed it, that all the tests are being performed, the radiographic and clinical, all the diagnoses have been made, and the patient is diagnosed with irreversible pulpitis following a caries exposure and endodontic treatment. Patient is afraid of root canal treatment and he insists for filling. Now how you would counsel the patient for the treatment? He just is afraid or scared of the root canal treatment, and he insists you for that, just do filling for me. But now it's up to you that how you are going to counsel the patient for the root canal treatment. So it's a totally your way of dealing the patient and your way of convincing the patient, how you are justifying the procedure to the patient on different grounds. So the whole station will be about the counseling. You need to have a sound grip on your counseling skills as well. Then we have another sample question that could be asked, or similar to that. You can be asked the inlay, onlay, overlay, the pictures have been shared. First of all, they will ask you that identify the type of restoration. Then they will ask you the feature, the differences among all the three, and then indication. Definitely they will be asking that where that particular type of restoration is being used. Another sample question is about the chronic apical abscess. Chronic apical abscess. You have been given different types of pictures. In the chronic apical abscess, you'll be seeing out a sinus tract that will be draining out both intraorally or extraorally. It will be a peculiar and specific feature that this infection has reached to the chronic stage. And then a different kind of differential diagnosis can be asked, definitive can be asked. You can be asked about the causes, that is most probably an odontogenic infection. And then most importantly, the management plan that would go, you can go on with the incision and drainage and then the root canal treatment, depending upon that particular case. Similar to that, you can be given a picture of we can see a clinically you have a swelling in the region, in the palatal region, and then you will be asked about the differential. You can give different kind of differential, in that is cyst, a tumor, an abscess, any kind of different kinds of scenarios could be given. And then in the definitive diagnosis could be asked. In the case of definitive diagnosis, they would be giving you out some scenarios in which they will be pointing out towards the odontogenic infection or the culprit tooth. In that case, your definitive will be the palatal abscess and the causes for which is the odontogenic infection, and then the management plan can be asked. So these were the pictures related to the abscesses. Then we have another scenario, that is a patient of age 10 presented with a vital and broken down tooth. Number 1, due to the trauma 20 years back, apex seems to be slightly open. Now what is your diagnosis and your management plan? So we know that tooth is broken down, but it is vital, which means that it is vital and the patient have a trauma 20 years back. Then most probable chances is that we can see the clinical pictures as well in the radiographs. We have seen that the broken down, it is quite, the fracture line is quite in that level that the pulp has been exposed, most probably. So it will be a complicated crown fracture. Now the apex is open. Most important thing to be noted is that either the apex is closed or open. So in this case it's open. Then you will go on with the partial pulpotomy, placement of MT over the pulp for the apexogenesis, then followed by restoration with the composite. Another important picture, that is the clinical picture radiograph, which can be given to you, or it could be asked, was about the cervical resorption. That is, a pink tooth is given, and we can see on the radiograph that there is a kind of resorption, that is the internal root resorption. Again, the diagnosis and management will be asked with that regard. Other important clinical picture is of a sandwich technique that is used in the restorative dentistry, in which we have the glassy ionomer cement, and above that we have the composite. So we have a sandwich, we simply can say it's a sandwich composing of the dentine, then above the dentine we have the GIC, and then composite. So picture can be given, and you ask you which type of sandwich technique is this. In the class 2 kind, it's the open sandwich technique, and in the class 1 kind, it's a closed sandwich technique. So in this picture, it is the open sandwich technique. Then indication and composition can be asked. Other important clinical picture is given, that is of you will be given a picture in which there will be a filling, and in that demarcating line at the margin will be discolored, which is basically the composite discoloration. That will be asked in the diagnosis, what clinical condition is this. So it is a composite discoloration. Then again, the causes and how you are going to correct and manage this. Other important thing about the OSCE examination in the operative dentistry and endodontic is about the procedural accidents, in which they might be asking about, for example, first station is of radiograph is given and the file is broken down, file breakage has occurred. First of all, they will ask you about the diagnosis, and then they might ask you at which level the file breakage has occurred, and according to that level, what is your management plan and the prognosis of the tooth. So you need to be proceeding on with the management plan on the basis in which at which level the file breakage has occurred. Another important scenario is of the perforation. Again, the clinical pictures will be given. In that, we can see a clear bleeding at the floor, which obviously pointing out that floor have been perforated. On the radiograph, it can also be seen. For cation area, you will be seeing out the radiolucencies and a breakage in that region. It's a break of radiolucency could be seen. That will be indicating out towards the perforation. In the perforation, they might ask you about at which level the perforation have occurred, and according to that, how you are going to manage and repair the perforation defect. So another important radiograph which is frequently asked, and it's very much repeated in every OSCE examination, is about the vertical root fracture, in which they will be giving you a radiographs where you will be looking out with the J-shaped radiolucency. That is the most particular and peculiar appearance of the vertical root fracture. So in that case, again, the point of identification, definitive diagnosis, differentials, and then the management. Another important clinical pictures that might be given in your examination is of the morning glory diagram. That is of the picture basically indicating the minor, major constructional and the radiographic and the anatomical apex, the cemento-dentinal junction. The whole picture of that is given. That is often present in your textbook, so do it very well. It could be asked in your OSCE examination, and you need to label that different in that cases. At last, there is another OSCE station, that is shared of a blunderbuss canal is given, and in that case you will be both a clinical picture will be given and a radiograph will be given, and then you will be asked about the diagnosis. That is very particular in case as a funnel shape appearances of the blunderbuss canal. So this was all about the OSCE Guide of Operative Dentistry and Endodontics. Their sample questions and stations have been shared with you guys just to give you an idea that what type of questions can be asked in your OSCE examination. Again, it could be modified. There are high chances that other questions might come according to your board of examination, according to the pattern, how your college is conducting your OSCE examination. So keep that in mind, and also do preparation in regard to your patterns of board examination as well. Consider this video along with that. So thank you so much for watching the video. Don't forget to subscribe, like and share my channel, and also click on the bell icon so you will get notified about the future videos and updates. Thank you.